The best treatment to avoid spreading herpes. Herpes is the most common infection. Roughly 8 out of 10 American adults have faced oral herpes. Herpes simplex is a viral disease that is caused by both herpes simplex virus type 1 and type 2. The virus causes lesions on skin. Infectious secretions from the infected areas are involved in spreading herpes. Infections caused by herpes. Herpes virus causes different infections on different sites on the body, including oral herpes and genital herpes. On both locations, the herpes cause blisters and cold sores. Some other infections can also occur. Herpetic whitlow, ocular herpes, cerebral herpes infection, neonatal herpes are all caused by herpes simplex virus. Route of transmission. Herpes simplex is a contagious disease and can spread from infected person to non-infected person. Following factors play a role in spreading herpes. An infected mother can transfer the virus to the baby at the time of birth or during pregnancy. Kissing and sexual intercourse can transmit the virus from infected person to the healthy one. A skin-to-skin contact is the main source of spreading herpes. The sources are the small breaks in the skin and mucous membrane. Open and moist sores and leaking fluid during a herpes infection make it more contagious. Herpes transmission can occur by sharing things of personal use such as towels, razors, soaps, bed sheets and clothing. Modes of transmission. Herpes virus stays inside the body for whole life and produces symptoms that keep coming and going off. There are 2 modes in which herpes virus can be transmitted. 1. Symptomatic transmission. It is when noticeable signs of infection are present, including itching, sores and blisters. Mostly the herpes is transmitted by active lesions in symptomatic pathways. 2. Asymptomatic transmission. When there are no symptoms but viral shedding is occurring on the body surface. Viral shedding takes place just before and after an outbreak. It is the high-risk time when herpes can be transmitted to others. Prevention. The herpes virus is relatively harmless and doesn't impose any threat on life. Still, it's better to avoid it. There are 5 ways to prevent its infection. 1. During oral herpes, do not let the mouth secretions touch the contact lenses. 2. Do not touch the herpes sores. You may transmit the virus with infected hands to others by touching. 3. Use proper anti-herpes medication. 4. Do not make sexual contact if one of both partners is infected. 5. Do not share things of personal use.